To Your Health, where we talk to local health leaders to help you feel better, live better, and be better.
Hey everybody, welcome to Your Health. Well, today we're going to talk about breast cancer awareness because I am joined by somebody who knows a lot about that, Dr. Dimitra Mihalidis from ThedaCare, an oncologist with the Cancer Care team. Welcome, doctor.
Thank you for having me.
Absolutely. Let's just jump right into it. Let's talk risk factors for breast cancer.
Sure. So, there are a variety of risk factors for breast cancer. Two of the most important are actually being a woman and being over the age of 50. There are other risk factors, some that we can change and some that we can't change. So some, risk factors that we can't change are, our family history. So having a family history or personal history of breast cancer, or inheriting a mutation which might predispose you to breast cancer would be considered a risk factor. Also, having dense breasts would be considered a risk factor, but we can really focus on the risk factors that we can change. And so that would be lifestyle risk factors, such as, decreasing alcohol intake, keeping active, being mindful of our body weight and keeping, a healthy weight. And then, trying to minimize hormone replacement therapy in some settings in the, after menopause to decrease, exposure to hormones as well.
Absolutely. Change what you can because the risks are there. All right, what about anything in the latest in recommendation? When should people get screened?
Right. So screening, for the average woman at risk, the recommendations are currently to consider mammogram beginning at the age of 40.
Got it. So we're thinking about those type of risk factors that you have, but getting in there, getting screened. At the end of the day, it's October, it's breast cancer awareness. What do you want men and women both to take away from this?
It's really important for women to talk to their doctors about getting a mammogram annually beginning at the age of 40. Early detection really can matter. Those breast cancers that we find on screening mammograms are usually smaller and less advanced. So really catching them on that screening mammogram can really impact your life and your outcomes. And then just staying healthy, both men and women.
Yeah, it really comes down to that. Get a doctor's advice. Well, doctor, thank you for educating us in this very important month. Dr. Dimitra Mihalidis from ThedaCare, thank you so much for joining us.
Thank you.
And thank you for watching To Your Health.
The preceding was a paid advertisement.